Okay, shoulder evaluation, we would take a past history, a present history, using OPQRST, onset, provoke, quality, region or radiate, severity, and time, and then a sample history, which is signs and symptoms, allergies, medications, past pertinent medical history, last oral intake, and events leading up to the event. So then I would inspect for any swelling, discoloration, deformity, their posture. Are their shoulders equal here? The scapulae in the back, are they winging or are they okay? Here, you're inspecting for any atrophy or hypertrophy, and then when their arms are hanging, are their arms hanging equal or uneven? And then we're going to palpate the clavicle, so the bony palpation, the clavicle, palpate the sternoclavicular joint, clavicle, acromioclavicular joint, the humerus, the head, and then the bicipital groove in here. The scapula, so the acromion process, the coracoid process right there, the inferior angle of the scapula, the medial border, the lateral border, the medial angle up here, and the supraspinous fossa, this fossa where the supraspinatus runs through, and then the spine of the scapula right here. Soft tissue, the rotator cuff muscles, the supraspinatus we just got, infraspinatus here, subscapularis is underneath the on the anterior side of the scapula, so it's hard to palpate, and the teres minor below the infraspinatus. Deltoid, anterior, mid, posterior. Pectoralis major, you can just estimate the lateral side out here. Pec minor, a little bit below. And then the trapezius, we have the upper trapezius, the middle trap, the lower trap. And then the rhomboids major, so if you imagine the scapulae here, rhomboids major, and then the minor here. The latissimus dorsi, this big sheet muscle here. And then the biceps here. The coracobrachialis is difficult to find. Nikki and I were just discussing the purpose of that small muscle, but that's where it is. Levator scapulae here from this angle of the scapula up. If she shrugs her shoulders up, that's what elevates her scapulae. Relax. And then the serratus anterior, these finger-like muscles that help protract your scapula. Now for range of motion, we would do it passively or PROM and actively AROM. I'm going to choose to do it actively. Might be faster for you guys as well, but either way. So flexion, I'd have them flex to 180. I'd have them extend to 60. I'd have them abduct to 180. Adduct to 45. Horizontally abduct, no degree. And then horizontally adduct. Scapular elevation, scapular depression, scapular protraction, and then scapular retraction, pulling back. And then internal rotation to 90 degrees, external rotation to 90 degrees, and then you're going to say, I know that internal rotation and external rotation are sometimes also called medial and lateral rotation. Muscle actions or resisted range of motion for flexion. So you're going to have one kind of base hand on the trunk, pull up into flexion, go up into flexion this way, pull, 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 and I'm testing the pec major, the anterior deltoid, and the biceps. And then I'm going to go extension, again a base hand here, push back, 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 latissimus dorsi, teres major, posterior deltoid. Then for abduction, supraspinatus and middle deltoid, just going to push up and out, abduction, push, 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 push. Then adduction, back down, pull in, pull, 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 pull. Pec major, latissimus dorsi. So now for internal and external rotation, you could do it here or up at 90. It's probably more comfortable for your patient to do it here. So base hand here, push out against me. External rotation, infraspinatus and teres minor. and then pull into internal rotation for the pec major, subscapularis, latissimus dorsi, and the teres major. Horizontal adduction, so she's going to pull across her body. Horizontal adduction, anterior deltoid, pec major, coracobrachialis. So I guess the coracobrachialis does have a purpose, this little tiny purpose. And then horizontal abduction, pushing out, posterior deltoid, latissimus dorsi, teres minor. Then we're going to have her, it's difficult for all these scapular movements, you don't have to resist. So you do not have to put your hands on them for these scapular movements, but I do want you to be able to name the muscles. So scapular abduction and upward rotation, kind of pushing out the serratus anterior. You don't need to resist that again. Relax. And then shoulder elevation, that's the trapezius, the levator scapulae. Scapular adduction, pinching your shoulder blades together, your scapulae together, middle trap and rhomboid major. And then relax, scapular depression and adduction. So down, lower trap, so depressing and pinching your shoulder blades together. Scapular adduction and downward rotation. So pinching together and then kind of rotating down, rhomboid, major and minor. Let's see. Yeah, so for the lower trap, it's sort of focus on the depression part, and then for the rhomboids, it's more of the pinching. So then you know about the neurological, you're going to take that quiz right when you get there. Motor C5 deltoid, you're going to check the deltoid, does that work, motor function work? C6 wrist extensor, C7 triceps, wrist flexors, finger extensors, C8 finger flexors, T1 finger add and abduction. Now you're going to go sensory, so in anatomical position, C5, you'd say, do you feel this the same on both sides, sharp or dull? But C5, 6, 7, C8 and T1. And then for the reflexes, C5 is the biceps tendon, relax here, relax. You would hit the biceps tendon here. C6 is the brachioradialis in this position. So relax here, hit with the reflex hammer right there with the brachioradialis tendon coming down. And then C7, triceps tendon, relax, relax, relax. Hit the tricep tendon, looking for a reflex there. Radial pulse, so you're going to actually take a radial pulse with a watch, with a second hand or that's running seconds. Take it for 15 seconds, the radial pulse here. So say I get 20, I'm at 20 for 15 seconds, multiply it times 4, that's 80 beats per minute. And then you're going to report it in rate, strength, and rhythm. So 80, strong, and regular, or it would be 80, weak, and thready. But for this, you're going to just say 80, strong, and regular, or whatever number you get multiplied by 4. Strong and regular. Recapitalization test, press, let go. Color should return in less than 2 seconds. And if they have nail polish, you would use this side. Color should return in less than 2 seconds. And then you would compare bilaterally.